factors together is to start to look at research priorities that are relevant to healthcare and frontline healthcare administrators, policymakers, and to develop and derive evidence for uses of different strategies in healthcare services, policy, training, capacity building, and with the intention that since you've got the policymakers and frontline health professionals on board, there could be rapid uptake and implementation of these projects. So we're a team that's up to date, has been investigating the use of internet-based technology to deliver patient-focused cardiac services. We're in a state of flux right now, which I'll go into. And we have a diverse membership of people from Simon Fraser University, University of British Columbia, University of Northern BC, and University of Calgary. And then established partnerships with Northern Health Authority, PHSA, Vancouver Coastal Health Authority, and we've got partnerships in progress with Fraser Health, Vancouver Island Health, and Interior Health as well. And a number of personnel that have been circulating, helping everybody out today as well. So the mission for the BCATPR is to become a national leader in the research and development of innovative telehealth care services and policy aimed at improving patient care. So it's a very patient-focused group. And we look at that from the perspective of the patient, improving provider communication and care, and then also providing information that can be useful for policymakers. And some of the work that we've done today will be highlighted today. We have a number of activities that we've done in the past and present. One of the things if you're dealing with patient uptake of websites for their service delivery, the question always comes, well, are your target audience actually accessing the internet? So one of the first things we did was an internet access use survey, and it enlisted 294 cardiac inpatients from Prince George Regional Hospital and St. Paul's Hospital. Of those, 2/3 had home internet access. So, and of those, the overwhelming majority had high-speed internet. And we found that of the people who had home internet access, 70 to 80% were accessing their internet at least once a week. there's a myriad of chronic diseases that we could target. But what we want also to know is which ones will be suitable for the medium of telehealth, which ones may not be, and which ones should have the highest priority. So we've been working on conducting a literature review, conducting a survey of provincial stakeholders. So that's ongoing, and hopefully some, if not all of you, have actually received an email soliciting participation in our survey where we're getting input from people across the province as to what directions telehealth in chronic disease should take. So if you haven't had the opportunity to complete that survey, we'd greatly appreciate it. From that, we're identifying key informant interviews. So there's an option to include your contact information so that we can conduct interviews. I think we've lined up about 25 already, and so there's space for a few more. And these three things together are going to help to set priorities for where we're going to go for beyond cardiovascular disease and other chronic diseases, and build a technical architecture. And then it may look like something anywhere from like 3 to 6 chronic diseases, recognizing the fact that if an individual has one chronic disease, they're either have another chronic disease or that at risk for having another chronic disease. And so instead of having, with a lot of push for integrated care clinics, multi-chronic disease care clinics, we want to move that way in telehealth as well. So, so you've probably seen our web address. In the next few weeks, you can expect another email push from us as we redesign our website to make it more interactive, more exciting than it is now. And with that, I would like to begin with our sessions and introduce our first speaker, Dr. Richard Scott, who is an associate professor in the Global eHealth Research and Training Program for Innovation in Health Technology at the University of Calgary. He informs me that this is probably one of the few days that was warmer here than Calgary. It was 2 degrees this morning when he left. It's one of those few times where you're happy to be in Vancouver comparing weather to other people. He examines the role of eHealth, which define telehealth and health informatics, in the globalization of healthcare, including aspects impacting the implementation and integration of eHealth globally and locally. Local eHealth, as Dr. Scott defines it. He also promotes the application of culturally sensitive and technologically appropriate eHealth solutions in the international context and is pursuing research in Asian, African, Latin American, and Caribbean countries. Internationally, Richard is a member of the advisory board of the Commonwealth eHealth Program, member of the U21 Global eHealth Committee, chairperson of the WHO's GOEU 21